Dr. Sarhan and I are going to talk a little bit about facelift. And facelift is one of the most important procedures that we do. And we've done a lot of refinement over the years in our technique. And one thing that is the ultimate goal for us is to have a natural look. So our patients are constantly telling us that after their facelift, their friends don't know that they had surgery. So what they recognize is that they look a lot better. They think it's their hairstyle. They think they've lost weight. And I always like to hear that because it means that we're not giving them a surgical kind of look or an artificial look. And another important thing are combinations of procedures. So we're going to talk today about, the facelift, the different types of facelift, the methods that we use, but also how we combine facelift with other techniques, such as skin rejuvenation.
I think there's been a lot of advancement in how facelifts are done, and going to basically every different surgeon has a different facelift that they do in terms of the operative technique that they use and the adjunct techniques that they use. So you can get CO2 resurfacing at your local med spa that you're basically not even going to really notice a difference before and after. You're just going to be a little bit red, versus a really significant resurfacing where the entire outer layer of skin is fully rejuvenated, and you can have really long lasting, durable results that last for years and years, rather than just being a little bit red for a few days and then being back to how you were to begin with. And that's a kind of a similar thing with facelifts. There are people that do facelifts with thread lifts, again, at the med spa, and then all the way to the highest level of facelift, which is a deep plane facelift, where you're going to the structures in a lower layer of the anatomy to have a rejuvenated full facelift.
So especially with combinations of treatments, we can achieve a comprehensive facial rejuvenation. And we use the terminology express lift for our facelift, and that really has to do with the speed of the recovery. So it's not like it's like a mini procedure that is not really doing the full extent of what a facelift should do. So it's a genuine facelift by every definition, but the recovery is quite rapid, and that really has more to do with the fact that we are using local anesthesia, which has a lot of advantages as far as especially safety, but also it will minimize the after effects of bruising and of swelling. So many people actually look quite good at day 7, which is just the time when we take out the stitches.
I think there's a lot of advantages to not using general anesthesia. With general anesthesia, there are a lot of opiates, and that can cause a lot of constipation, nausea, vomiting, all of those things you want to avoid when you're dealing with something really delicate like a facelift. So the recovery is just so much better.